Kuwait 2035's vision really stemmed from His Highness the Emir's vision to transform Kuwait into this new era that diversifies away from the oil mainly into other sectors. And it really revolves around 7 pillars, one of which is high quality healthcare. At the moment, majority of healthcare services are provided by the public sector, and through Kuwait Vision 2035 is to diversify and actually make the private sector also a key player in providing health services to everybody. And also there's a major focus on non-communicable diseases and chronic diseases to hopefully banish them and make everybody very healthy in the state of Kuwait. What's super exciting about the digital health transformation in Kuwait's Vision 2035 is that it's a cornerstone and a pillar that we cannot escape anymore. It will enable the sharing of information for patients across the care disciplines and across the healthcare organizations. But not only that, what's super exciting is that the patients themselves or the consumers of healthcare services will also have an active role in their own healthcare. But what we need, and that is definitely something that the Kuwait Vision 2035 focuses on, is enabling the young minds and talents to really tackle this issue and bring Kuwait to this new digital health era. We're super excited about that.
To understand the current status of digital health in Kuwait, we have to look at the context of the health sector in Kuwait, especially within the GCC region. Kuwait was a pioneer. You're talking about in the early 80s in the GCC, Kuwait was the first country to have these huge hospitals, 500 plus bed hospitals. And as such, Kuwait is a very mature market in really subsidized healthcare. Moving forward, as Kuwait now is investing a lot in growing and scaling up its health sector, and we see that with the mega project going on, almost doubling the bed capacity of the country, Kuwait realized that they need to turn into information technology to really get the most out of what they're trying to do in overhauling their health sector. And as such, we're seeing a lot of focus and investment into digital health, into IT. There's a lot of push for the health record, for adopting new mobility technologies for clinicians, as well as a lot of patient engagement around using smart applications and what have you. So what we're seeing, a lot of investment and maturity growing into the digital health sector, and we're very happy to see that they're doing that in parallel with adopting international standards as HIMSS and the likes. Sabah Al Ahmed Urology Center is an important medical center in Kuwait. It was a vision by His Highness the ruler of Kuwait, Sheikh Sabah Al Ahmed, when he realized that the country needs a high caliber specialized center in urology. He donated that center totally to be a state-of-the-art urology center as well as a research center. ATC was involved from day one. It was a company that was able to be even involved in the design of the center. I mean, the design of the center is groundbreaking by itself. The center looks like a kidney if you look at it up from the air.
The Ministry of Health, by improving the medical system in all aspects, thought that they should introduce a new health information system all over the hospitals. And the idea is to have a quick access to the patient's record, having a more secure records, and a paperless hospital. The ministry gave us the freedom to let's say, tailor each hospital to its needs according to their system.
Having the information ready on the system, this is very important so that I don't need to call the doctor to ask about some information about the patient, which will help me in writing the report, and also no need to call the patient and to sit with him. This might be important in certain situations to clarify certain issues, but when you have it ready on the system, this will facilitate to write the report easily and in a more short time.
Very integrated patient health record system. So all the patient's records are available to the patient at any time of the day, round the clock on his smartphone. I think from a clinical perspective, there are basically two major advantages. One is the efficiency, because this is time saving, so I can go through my patients faster. And in another way, I spend less time on the computer ordering stuff. I spend more time talking and understanding the patient's problems. This is number one. And number two, of course, it makes sure that we don't miss out on anything, because we are sitting in my office and I'm creating an order set in a very relaxed way so that I have everything complete. Whereas in an outpatient, if I had to do this, I would be under, my mind would be on many things. So that way it ensures that I don't miss any investigation. It's up to the doctor to have a look at the warning and then either correct it, or if it's okay, proceed with the prescription. Also, the prescription box gives us the previous medication the patient has been taking, so it gives us a very good idea of what the patient has been on. This is especially useful when multiple physicians are involved in patient care, so we can each other see what the other physician has prescribed for the patient. Patients are also pretty impressed that that they don't have to carry around their old x-rays and all their reports every time they come to meet us. Everything is available for us to see immediately. And since the whole process makes the working more efficient, it's faster, I can see more patients and do a thorough job.
So the Da Vinci is comprises of 3 units, the console and the robot and the tower. The rest movement of the instruments make it very easy for the surgeon to do the operation. We have a simulator for this robot, and the program for teaching the doctors here took 3 weeks or 4 weeks. This is to teach them about movement and everything. The patient is very surprised that they can go home after 1 day or 2 days of operation. They heard that they will stay for 10 days in the hospital. After 1 day or 2 days, they are discharged and they have full range of movement. We are trying now to get more robots and more advanced one.
Since we have adopted the electronic system in our hospital, and I find it's easier to give appointments and assign the patients for a specific time in the clinic. So usually we don't have an issue of crowdedness in the clinic here, and at the same time it was very easy for us to retrieve the patient data from the system, and also the system helps us if there is any interactions with medication. It gives us alerts, and from our system we can directly request what we want, and we can even assign a next visit for the patient and book it from the same station, or booking for a specific time for surgery. So it makes our life easier and faster and leaner for the patient. First of all, to reduce medication errors, you have to teach everyone about the medication errors, and everyone should be taught about what they are using, about the drugs they are using. But here the rule of the machine comes as a second check point. So if I did a mistake, it alarms me immediately. From the start, we had this, this common physician, resistance, but with collaboration with the IT team, with changing of the culture, with adoptions, tailoring of the system according to our needs, slowly we start to get used to it. Slowly we start to get get used to it as a part of our life.
Adan Hospital is an important hospital in Kuwait. It serves a population of over 1 million. It's a big hospital that currently boasts almost 1,000 beds. And it's a general hospital that serves all specialties. The emergency department in Adan Hospital serves between 2,000 to 2,500 people a day, cases a day. So this hospital also has specialized centers, like a specialized cardiology center as part of its emergency. So looking into adopting an IT system that, number one, needs to provide clinicians with an electronic medical tool that links everything together. Number two, preserves the investment of the hospital in a lot of specialty IT systems that were scattered all over the hospital. And number three, that helps the hospital management achieve their international accreditation goals because they were educated about HIMSS, the importance to adopt HIMSS for patient safety and quality of care. Hence, Sapphire, we found, comparing to a lot of other systems, we found it's the best system that fit the reality of Adan Hospital, the scalability that Adan Hospital needed, taking into consideration that the Ministry of Health right now in Kuwait are building another expansion to Adan Hospital, that's another 1,000 bed. So whatever they are establishing in Adan needed also to grow into the future. HIMSS and their MRAM and the related standards play a big role in validating those investments and really in recognizing hospitals that are able to adopt these technologies and investments in the right way.
Before Sapphire, we never had a proper hospital information system. All what we had was recording systems, either paper recording systems or electronic recording systems, which didn't do much except for entering data and saving it. It didn't help us in easing any process, or it didn't help us in having any intelligence with the way we handle our data. After implementing Sapphire, it helped us in both ways, in stock management and in delivering safe and high-quality patient care. With the Sapphire system, when we come to stock management, we were able to control the expiry dates, the quantities that we request from the CMS, which is the Central Medical Store. We are able to identify how many of this medication we have all over our locations and our hospital, which is something we never had before. All our pharmacies are linked together, and they're linked directly to the store. So even if the item is not available in the store, they will tell us immediately where we can find that item, in which pharmacy in our hospital. It will tell us the quantity available, the expiry dates available. So we have an easy access to all the information we need to manage our medications properly when it comes to stock management. When it comes to medication safety and quality improvement, with the Sapphire system, because we're entering all the data electronically and the doctors are entering the prescriptions electronically, we have all the medications, history, the previously prescribed medications, and the current medications available in the system, so we can check for interactions easily. We can check for duplication of medication easily. We know exactly if the patient was taking, let's say he came last week and he was dispensed a certain medication. We know how much he has at home and how much he has left to finish the course, so we know if we need to cover him or not. If the patient has a repeat prescription, for example, we can see it on the electronic system. He doesn't have to come with a paper prescription. If he lost it, we can see it on the system and we can dispense the medication immediately for him. The doctors, once they saw how the program was easy to use, they thought it's going to be very difficult and very complicated, but it's as easy as just logging in and entering just the first 3 letters of the medication, and then you're going to have all the data. It's a lot easier than writing the prescription. Once they experienced that, we started with one clinic, second clinic, and now we have the Boost OPD, all of them. The cardiac center is all fully electronic. The medical center is fully electronic. They're convinced now that it's going to make their life easier, especially because now the doctors, from just entering the medication name in the system, they know if it's available or not. They know the different concentrations that's available in our pharmacy. They know if they need a substitute, what are the substitutes available in the pharmacy, just by an easy click on the system.
We daily receive about 2,000 to 3,000 patients per day across our emergency department, different emergency departments. Sapphire made it easy for us for a lot of ways. So it improves the healthcare, number one, it improves patient safety, number two, and it makes all our life experience a lot easier.
ATC is a company that has been in the health sector since the early 80s. ATC is unique that it is a company that is able to commission and execute 10 key projects. So the company has executed 10 key projects that from the design of the hospital up to the commissioning of robotic surgery, pharmacies, biomedical lab, etc. Now, moving forward, ATC has realized that really to commission all this and to get the best benefit out of it, you needed IT that links it all together and makes sure the clinical flow works and flows seamlessly to the clinicians in the right way. And hence, ATC invested a lot in its human capacity and human capital in that. That natural growth and organic growth went into those people understanding and studying the HIMSS and really adopting those best practices and those understandings in the hospital. That's why ATC now has this human capital that are very experienced in the HIMSS guidelines and the HIMSS MRAM, and really adopting them and pushing them and pioneering them into hospitals. And we're able, through these ATC teams, to have hospitals, the first time ever in Kuwait, to become HIMSS accredited. We're seeing our market leads in other GCC countries that are wanting specifically this kind of value into their hospitals, and hence we saw our we'd say, go-to-market approach around HIMSS consultancy grow and become more strategic for the approach.